In this segment, we're going to look at some of the accessories that may come with your machine or you may wish to purchase separately. We'll start by looking at the bipolar equipment again. So this is the standard bipolar supplied with this machine. So we have a forceps here, which is removable. This is a standard size if you compare it to my hand. These have a plain tip, but you can also get forceps with a vat tooth tip. That's quite nice because if you use this on muscle with the plain tip, you will get some muscle movement when you activate the current through local muscle stimulation, and that can slip out of the plain tips, whereas a vat tooth allows you to hold it more securely and also to lift a little and concentrate the current. But these forceps come in different styles, of course, all manner of styles. So this, as you see, has an angle to it, which allows you to keep your hand out of the vision, and you might prefer that. And these have some very small, let's say, jeweler's forceps here, even finer, which you might prefer, for example, for feline thyroidectomy, or you might prefer for conjunctival or ocular surgery. We'll look at the other end of this for a moment. This is the standard EU fitting, which, as you see, has a plate on either side, slides into here. The alternative is the US fitting, which has 2 pins and will not go into this lead. So do bear that in mind if you buy this forceps after purchase. Make sure you get EU fitting if you have an EU connector. Incidentally, these are all intended to be autoclavable. They won't last forever, but they will last for some cycles. I prefer to put mine on the gentle cycle on the autoclave. And likewise, these leads, as applied to the machine, are also autoclavable. Again, I prefer to use the gentle cycle, and I prefer not to soak these. So I will wipe these after use, but I will not leave them soaking in a cleaning solution. I will simply clean them manually. The other end of this, and this is the lead that comes with this machine, you'll see the bipolar has 2 plugs, a standard and a large, which is for this machine. So the large goes into the plate return there. If we were using this in monopolar mode, and the normal goes in the one next to it. If you buy spare cables afterwards, you may instead buy a cable that has 2 tips of the same size, small and small, in which case you need an adapter for this machine. So that adapter goes in there, and then this will accept a small and small. So this will come with your machine. Typically when you buy it, you need to remember what it is and make sure your staff don't lose it. But that's what it's for. It does say bipolar adapter on there. So that's the accessories for bipolar. Let's put those to one side. With the monopolar, remember when we set this up, we're going to have that plugged into there. Then we have the patient plate. Here's the standard plate that's provided with this machine. As said, you can have other plates available to you. This is reusable. Again, I don't soak this. I wipe it down after use. And I don't recommend in our patients the use of disposable self-adhesive plates, which are commonly used in people. Because they're not intended for head skin, and also if you try to use them more than once, you'll get patient contact problems. So we use a reusable, flexible plate like this, or a metal plate. So this, you recall, has a standard connector which goes in here. Just set this up so you'll remember. You have to have the patient plate under the patient. Turn the machine on. patient plate is going to go under the patient. You'll remember we need good electrical contact. So we're going to use electrostatic jelly, electroconductive jelly. Under there. So the accessories, again, you can buy separate pencils. This pencil, as applied with this machine, has the buttons, which I like. I find convenient to use. You can get pencils without the buttons, which again, then you need to use the foot pedal, commonly supplied with the machine. And remember that yellow is cutting and blue is coagulation. So this has a removable tip. So this is what is most widely used, this blade for monopolar. If you use the flat side in contact with the tissue, then it will have less cutting effect, so that tends to be used for coagulation. Or you can use the tip and the side, the sharp edge, as it were. It's not sharp, but the narrow edge for cutting. But other tips are available. All manner of different shapes for different purposes. So very commonly in human surgery, they might use a loop like this. Turn up my power here. I think this loop is rarely used in veterinary surgery, but could be used, for example, to remove papillomas, perhaps sebaceous adenomas, that sort of thing. So this is going to cut and allow us to take a slice like that quite nicely. You need quite a lot of power for this to work effectively, because we have quite a lot of contact between the electrode and the patient. So the loop might be used occasionally. Different size loops are available. Another one here, you'll struggle to see this, but there's a very fine wire here. So what you remember from what we talked about before, that we have more effect with a high current density and a small contact. So using a wire produces a very effective cutting effect because it has a very small contact area. On the other hand, the wire will rapidly collect coagulation material because it's a fine instrument, and so it will be covered in debris and lose its effectiveness quite quickly during the procedure. But that can be a useful device if you are doing some very fine work. Take the wire out. Occasionally used on a coagulation mode for destroying tissue is a ball. Let's give this lots of power. So using the blue switch, you can see that is essentially destroying the surface of the tissue. And because it's a ball, it doesn't collect too much coagulum, so the surface of the ball remains clean, and we can. There you can see we could use this. Suppose I've removed a gingival mass that I believe to be a epilus. Can't usually close the gingiva, there may be bleeding points from the surface, and having removed it perhaps with the loop, I can then paint the surface with the ball, and that will control any remaining bleeding and perhaps destroy any remaining tissue. One accessory you might consider but hasn't become standard practice in veterinary surgery is a smoke evacuator. So let's just look at what's actually happening here during monopolar electrosurgery. As I activate and cut, you will see a cloud of smoke appearing. A lot of this smoke is steam generated by the electrical current, and some of it is smoke, meaning burnt microparticles. Now, the reality is most veterinary surgeons are only using electrosurgery for short periods of time and short procedures, and also that our patients generally do not have infections that might be transmissible to us. So when you do this, if there was, for example, a viral infection or a prion infection of the tissues, then those infectious organisms could be present in the smoke. In human surgery, it would be standard to use a smoke evacuator. So there's a shroud that fits around the monopolar pencil and goes to an evacuating air pump, which removes the smoke and reduces contamination of the theatre environment. So certainly, if you're doing any amount of monopolar electrosurgery, you should consider equipping yourself with a smoke evacuator as an additional accessory. So those are the accessories that you might wish to consider. There's one more I wanted to show you. If we're doing laparoscopic surgery, and of course in veterinary patients, the commonest laparoscopic surgery is laparoscopic ovariectomy, usually in the bitch. And there are better and more sophisticated electrosurgery machines that we talk about in the final segment. But with a standard electrosurgery machine like this, one alternative to the more expensive and sophisticated machines and handpieces is this various brands. This is PowerBlade. This will plug in and work in a bipolar mode. It has a standard connector here. And this machine does two things. Firstly, in coagulation mode, we grasp a piece of tissue between the tips. And then when we activate the foot pedal, that will coagulate between the tips, so we can use that to seal the ovarian pedicle. And then we can activate it in a cutting bipolar mode, and that will advance a blade, and that will produce a current between the blade and the tips, and that will act as a cutting mode. So this is one way of dividing the ovarian pedicle, but is definitely not preferred. Might be useful as a backup option in case you have difficulty with your preferred advanced vessel sealing machine. Thank you very much. I hope that's been helpful to introduce some of the accessories. There is an awful lot of them in the catalogues. If you do buy them aftermarket, do make sure you have the appropriate connectors and understand the purpose of the different accessories.